Good afternoon, ladies and gentlemen, and thank you for waiting. Welcome to the NCC Webinar Series conference call. All lines have been placed on listen-only mode, and the floor will be open for your questions and comments following the presentation. Without further ado, it is my pleasure to turn the floor over to your host, Ms. Marilyn Ryerson. Ms. Ryerson, the floor is yours.
Thanks so much. Hello, everyone. This is Marilyn Ryerson with the QIO Improving Individual Patient Care National Coordinating Center. I would like to welcome you to this session on quality assurance and performance improvement, also referred to as QAPI. All lines are muted during this webinar. However, after the presentation, we will have time for questions and answers, so please make a note of the questions that may come up as you listen to the presentation. We're pleased today to have Dr. Jane Pederson as our featured speaker this afternoon. Jane is the Director of Medical Affairs at Stratis Health. She supports the development and implementation of the QAPI demonstration program through the development of tools and resources that will be used by nursing homes, and she also provides technical assistance at the nursing home level. Welcome, Jane, and thanks so much for being with us today.
Thanks, Marilyn. Well, the first thing I'd like to just go over quickly is the objectives that we'd like to cover today. First, we'd like to talk about QAPI as how it relates to person-centered care and really helping us create that foundation for improvement. I'll go through the elements of QAPI and then talk about some of the highlights from the 17 homes that have been part of the QAPI demonstration project. Talk about some of the tools and resources that are going to be coming available to support QAPI, and then just a quick update on the national rollout. So first, let's start with the really big picture. As we all know, our goal is to provide person-centered care, to really focus on that person living in the nursing home. And QAPI can help us get there. One of the things that I always like to bring up, though, is when we talk about person-centered care, it doesn't mean that we throw out the efficient work practices. It doesn't mean that we no longer focus on workflow or the needs of providers. And I think that's why QAPI can be a good foundation to help us get at this big picture. It looks, when we talk about QAPI, and as I talk a little bit more about the elements, you'll see QAPI uses data really to drive a lot of the work, and it uses many sources of data and input. So it brings in that point of view of the resident, but also focuses on what the organization, the caregivers, and everyone else needs to really do that kind of care that we want to do that focuses on the resident's needs, values, and preferences. So the big picture, but maybe the little bit smaller big picture, or what I kind of call is the basics, is that quality assurance and performance improvement, or QAPI, should not be thought of as a program, but instead it should really be how we do our work. And so when we talk about QAPI, we're always very careful not to use the term QAPI program, because that tends to signify that this is like a project or something that has bounds around it within your organization, where really this is meant to be something that permeates all the work you do and really how you approach your day-to-day activities, how you approach the work you do. The other thing that's really a basic principle to do QAPI is the ability to think and take action at that system level. And that, we all talk about that, but what does it really mean, and are we really putting it into practice? And so what you're going to see as QAPI is rolled out and some of the tools that are rolled out is they really do focus on helping people learn and practice this systems thinking and understanding that anytime we make a change in one place, it can have ramifications in other areas and unintended consequences. And we really need to think about everything we do in that context of a system, and that system thinking requires some practice. A little quick background on QAPI. It did come out of the Affordable Care Act that was enacted in March of 2010, and that legislation requires CMS to establish a QAPI program, establish QAPI program standards, and also to provide technical assistance to nursing homes. And that was really the unique part in that it isn't just rolling out a program, but it actually is giving CMS an opportunity to develop and test tools and resources that will be used to help QAPI or help homes get QAPI ingrained in their systems before the actual regulation or rule promulgation comes out. A little bit context. QAPI isn't something new, and probably many of you on the phone realize that. QAPI is required in other federally certified healthcare programs, such as hospitals, transplant programs, dialysis centers, ambulatory care, hospice. So it was really the long-term care setting that didn't have QAPI up until the Affordable Care Act. With each of these settings, QAPI has a similar framework, but in the case of long-term care, because it is a unique setting in that while it is a setting for care, it's also a setting for where residents live. And so the elements of QAPI that we'll talk about do certainly map to the elements of QAPI in the other settings, but there has been some adaptations for the uniqueness of the long-term care setting. So QAPI, when we talk about it as a foundation, kind of three things that we think about, and we've talked about each of these, but just as a reminder, really that foundation for person-centered care, because QAPI does rely on the input of residents and families. It doesn't just focus on publicly reported data and other sources of data. It really does need that input of the customer or the resident. It's measurement not only of processes but also outcomes. So we want to make sure when we make changes to processes, yes, we measure it because we want to know that what we've done is actually happening, but we also want to make sure that we measure the outcome. What is the actual outcome on the resident? Are we better able to meet their needs, preferences, and values? And again, defining QAPI is how our work is done and not a program. The idea is within your organization that QAPI has quite a broad scope. It's really the entire organization, all staff and all departments, with leadership modeling the way. And so it really does require leadership to take some ownership in QAPI and not have this, again, be that program that's handed off to somebody to implement. And it's a foundation for systems thinking. As I talked about, the tools and all of those things really help people practice that proactive analysis, practice that critical thinking. They help us and encourage us to use data and measurement. And so those tools are really our support for that systems thinking. And so QAPI can be that support. So let's just walk through the 5 elements of QAPI to give you a sense of what they are, maybe how they compare or contrast if you're familiar with other areas. But I'm just going to point out some of the key features of each of the elements, and I think then as the various tools kind of start to roll out, you'll see how they can map to each of these. So first of all, the design and scope. And what we mean by that is it's really, what is QAPI going to be in the organization? How is it going to look in each individual nursing facility, and what's the scope? How is it going to be implemented within all the various programs, departments, maybe unique resident populations that may be in that facility? So one of the key things to point out is that comment about the full range of services and departments. The next bullet, QAPI does not only address clinical care, but a wide range. We talk about QAPI impacting quality of life, resident choice, care transitions, etc. So the work of QAPI is not just clinical quality improvement, it's really organizational performance improvement. The aim is for safety while having clinical interventions or interventions that emphasize choice. Emphasis on using evidence to drive what we do whenever we can. And there's a written plan. We'll touch on this a little bit more again with one of the tools, but this is something that each of the homes will have to do in order to, as part of the QAPI regulation. And this QAPI plan is really intended to be a document that provides a clear picture to what that individual nursing home's unique approach to QAPI will be. So if I came into a facility and I really didn't know how they were integrating QAPI into their work, the idea would be I could pick up that plan and really understand how they uniquely are doing it in their organization, and that plan would be a living and breathing document that would continue to get revised and modified as their QAPI work evolves. The next element is the element of governance and leadership, and it's a very, very important element, and it really means that leadership is having to be actively engaged with this work. And so that's kind of one of the two important words, I think, of that first section is that actively engaged, not just handing it off to somebody, not just saying, yep, I really support QAPI, but really involved in it and modeling it, not only by supporting others to work in QAPI, but using the QAPI principles, tools, resources in their own decision-making and their own leadership of the organization. So using that systematic approach when they're gathering input across the organization, making sure that they're giving adequate resources to do performance improvement, making sure that we have a commitment to ongoing staff training to really help with that critical thinking, systems thinking. How do you use good quality improvement, performance improvement tactics to get your work done? That balance of culture and rights. And again, another very important one, that non-punitive culture. I think this is critical to QAPI and something that does need work across the long-term care setting, but really, if you're going to have systems thinking and say that, yes, we use systems thinking and critical thinking, but yet you turn and blame an individual or discipline individuals when something happens, that really says in that action that you're not thinking about systems and really is going to give no credibility. So leadership has a big role in this, and many leaders are going to have to look at, doing some self-reflection to say, am I really modeling QAPI and the principles of QAPI in my day-to-day work? The next one, the feedback, data systems, and monitoring. People say, well, gosh, we already do. We look at data. What QAPI is asking us to do is really look at data from multiple sources. So not only the things that are the standard stuff that you may get given to you, the quality measures, survey results, but looking at what are all the data sources that really help me provide a good picture of my organization. What reflects our organization? What data can we look at to really reflect our performance across all the things we do? And so each organization is going to have to look at to say, what is the pool of data that we want to really look at to do our performance improvement? It also focuses on use of goals and benchmarks, something that we don't always do real well in healthcare or in performance improvement. We maybe skip that step, but really saying, what are we trying to attain? Because if we don't set our goals, we don't define a benchmark, how will we ever know if we got there? The other thing with the data systems and monitoring is just this whole skill set around interpreting and translating data into something actionable. Again, as homes are starting to work in QAPI, this is a skill that people are going to have to build because it's really more than just looking at data. It's really learning how to take data to get information and then using that information to guide our understanding, to help us be able to say, okay, it's not just that we want to know how many people fell. We want that data to say who, what, why, when. So we can really answer those questions because that's what we need for performance improvement. So getting that skill of being able to analyze, interpret, and translate data is really what this element is speaking to. And then the last bullet, talking about prioritizing. is really saying, okay, we're not only going to use our data to find out what we need to work on, but we're going to have some way to objectively prioritize which is most important to our organization to help us step away from the, well, we're all working on this because that's what everyone's working on, sort of the flavor of the month, to say we're working on this because this is what our data tells us we need to work on as an organization. So being able to prioritize what work we do based on what our information about our organization tells us. The next one is the performance improvement projects. And I'd just like to point out it's only one of the elements. And I think sometimes it's easy for people to say, well, performance improvement projects, well, that is QAPI. As you can see, it is only one of the elements and not any more important than any of the others. But it is, I think, what people think of when they think of performance improvement. It's how do we then, once we find a topic, actually make an improvement. And so QAPI does give tools, resources in how to really effectively make a change in your process or make a change in your performance. And where QAPI goes with this is really to say you need to make the full loop. Look to see, understand where your opportunities are, where you need to change your practice, change the practice, determine if it actually had an impact, so actually follow through that with that measurement. Again, the goal setting, did we meet our goal, why or why not? If we didn't, go back and change what we did. So really to help learn how to do that, closing the loop, finishing it off, and making sure that when you do performance improvement work, it actually ends up in the result that you were hoping for, that you actually made a change that impacted, back to that big picture, actually impacted care of the residents, helping you better meet their needs, values, and preferences. So the performance improvement projects, again, are not all of QAPI, just an element of that. And then the final element of QAPI is the systematic analysis and systemic action. And this really, I think, permeates the other elements, and we talked about this right from the beginning of this talk, this whole idea of systems thinking. And that's really what this is getting at, is saying, okay, when we make a change, we need to think about our whole system, partially so that we know we can sustain, because if we make a change in the system, we have a better chance of sustaining that change over time. So sorting out how we can assess whether our changes are sustained and maintained over time. Looking at practice in that bigger picture, trying to address variation in areas where we prefer not to have variation, trying to look at our opportunities on that system level, and then also linking what we do in QAPI, the outcomes of QAPI, to things like policies, procedures, staff orientation, education, performance expectations, strategic planning. So the results of those performance improvement projects don't just end there. You say, okay, now how are we going to actually build this into our organization, into our system as a whole, by looking at these other areas? How are we going to make sure that it stays on through these other more systematic and systemic actions? So that's kind of the 5 elements of QAPI. So when you hear people talk about that, that's what they mean. And when we start seeing the tools and things come out, you should be able to see it linked to some of these elements. Now I'd just like to touch on some highlights that we heard from some of the QAPI demonstration homes. For those of you who don't know, there were 17 homes that have been part of this demonstration for approximately the last 2 years. And it's been their sort of task, really, to help with the development of the tools and resources by testing them out, giving feedback, saying what works, what doesn't work, and just seeing what it takes for a home to start building QAPI into their work. So a couple of the things that we're learning from this demonstration from the homes is that there is really value in having tools to help guide and teach systems thinking. Sometimes, even I personally thought, well, why do we need these tools? They're kind of a hassle. But what we really found from the homes is that by using these tools, they were able to have a framework and structure to do QAPI, and it really helped them from missing critical steps in the process. It gave them that reminder so that as they got more familiar with these things became natural. It became natural to do these steps of critical thinking and systems thinking. The other, and this probably isn't a surprise, is that QAPI is not a magic wand. It really is all about the implementation, and QAPI has tools, but they are just tools. It's about whether an organization takes it and really builds it into what they do. It's really that implementation piece that's going to make the difference, not just having the QAPI tools available and online or sitting in a binder or wherever you choose to keep them. Also that QAPI needs a strong champion or champions, but it can't be one person's job. If I think I talked about this a little bit with the leadership, but if a home decides that they're going to have the MDS coordinator be the lead for QAPI, and that's going to be their job to do QAPI for the organization, it's not going to work. It really has to be something that is everybody's job. Now, that doesn't mean that there isn't a team or a committee that is the one that's kind of monitoring what's being done through QAPI, kind of tracking on the various initiatives, helping with the prioritizing, things like that. But it's not just those individuals that are involved or doing QAPI. It's a variety of people working in teams, and those team members are shifting off so that everybody gets the sense that this is part of how we do our daily work. So where do nursing homes and QIOs begin on this work? Well, first, there are some QAPI tools, and I'll go through them quickly just after this slide, that include the QAPI at a glance, which is an overview, a self-assessment, some guiding principles, a guide to develop the QAPI plan, and then a guide to help create and develop goals. The other thing that is very important to do is to look around at all the other state and national initiatives, because, again, you don't have to choose one or the other. It's not do QAPI or this. It's really all of these things complement each other, and QAPI is a tool that can be used for performance improvement and again, to help homes change how they do their work. But the other initiatives that dovetail well with this and people need to look at how they're going to combine is the 10 Scope of Work and the National Nursing Home Quality of Care Collaborative, where they'll be coming out and learning about some of the best practices from the high-performing homes. And that kind of sets that benchmark or that goal for the QAPI work. Again, and then also a lot of the things that have been coming out of Advancing Excellence in America's Nursing Homes campaign, the tools there definitely support and are wonderful to use as part of QAPI or as part of performance improvement. And then the Partnership for Dementia Care, as we're all trying to work on improving the care for our residents with dementia, and especially the focus of antipsychotics. So all of these things, you're taking some time and looking to see what all is out there and how you may find that these fit together for your organization or which things fit with your needs the best. So now just walking through the tools, QAPI at a glance is meant to be certainly not a step-by-step in detail, but a good overview of what QAPI is and what it would mean to really get started building this into your organization. And so that's what that's meant to do, is for a team to go through and kind of look at the whole package and to say, okay, how are we going to start this in our organization? So it's that big picture with enough detail that it helps people get started, but doesn't contain all the various tools and resources. So I think it's a good starting place for facilities as they're starting to put QAPI into their work. The next is a self-assessment, and this is really designed to, once you're familiar with QAPI, likely through looking through the QAPI at a glance, to assess their internal readiness, or could also be used to track progress or development of QAPI in their organization over time. So this is where people can use the assessment tool to say, okay, so where do we first need to get started if we're really going to be successful in building QAPI into our work? And so they can kind of start to prioritize where they want to start their initial work. The next one is the guiding principles and scope. And what this tool is it walks nursing homes through a review of their mission, vision, and then how they will use QAPI to support their mission and vision. Like I said, QAPI isn't a program. It's about how we do our work. And it really should support and help homes meet their mission and vision. So this helps lay out for homes the scope of the program that is unique to their facility, and takes into account their specific residents, any specific programs, et cetera. So it helps them kind of think through that, so it helps broaden that scope and get them ready to say, okay, how do we want to do this within our organization? And helps them establish the principles that they're going to use to guide QAPI in their facility. The next one is the QAPI plan outline. As I mentioned, each home does have to have a QAPI plan. And so this tool is really meant to dovetail with the one before on the guiding principles and scope, because a lot of the information that's pulled out of the guiding principles will help start to fill out some of the things in this QAPI plan or outline. And this is meant not to be a prescriptive outline, but to give homes something to start with so they can start filling it in and continue to evolve and strengthen and fill it out more and more over time as QAPI becomes more established in their organization. And finally, there's a goal-setting worksheet. And the reason this is here is we found that setting goals is not something that all facilities are comfortable with. Yes, yet it's something very important to do right from the beginning, and part of that whole scope and plan piece. And so this just walks through how do you create goals that make sense. And so it's meant to give, like I said, a tool that helps people with that type of thinking, with that type of skill. Maybe after a while, as people get used to doing this, it isn't something that they'll need long term, but it really is something that people can follow to make sure that they are setting goals that are reasonable, that are workable, and are attainable. And it'll help them as they get into doing the analysis of data to really create information that they can make decisions off of. So that's the set of tools that initially will be available for QAPI to give homes a place to start. There's a number of other tools that will be coming out later, but this is represents the initial set. Just a couple comments on the national rollout. CMS really does have a vision for QAPI that incorporates providers, consumers, and surveyors. And so there will be complementary materials for each of these areas. The link where these materials will eventually all be housed is listed here on the CMS website. At this point, like I said, these are just starting to come out, but this is where you can keep this for as things go forward to find things out about QAPI. And then the final slide is just the various team members that have been part of this work. So what I'd like to do now is I'd like to just open the floor for some discussion.